Hi, I'm Dr. Stephen Perns, one of the instructors here at the Medical Sales College. This short video will go over different instrument categories. We have videos that will further take you through in more depth the various instruments that are commonly used in the operating room. The categories that we will be discussing are scissors. Surgical scissors are obviously used for cutting. Forceps, and a forceps is used for grasping as an extension of one's fingers to pick up or grasp soft tissue and or bone. Clamps are used in the operating room to secure or clamp drapes and or towels, as well as clamping or ligating vessels or other types of soft tissue. Needle holders will also fall under the clamp category, and they are used to grasp and firmly hold the needle at the end of suture when we repair incision sites or closure of tissue. Retractors help retract or clear the visual field. Rongeurs are aggressive, grasping type of instruments that help remove soft tissue and or bone from the operative site. Next, we talk about elevators, and elevators are used to separate or elevate tissue from bone. Mallets are an impaction type of hammer instrument that is used to impact various bone grafts or other types of hard tissue, and also are used as a hammer-like object to cut through bone with osteotomes. Curettes is another name for a spoon-like instrument that helps remove soft tissue and bone. There are solid curettes that act like a melon baller, that have a very sharp rim to peel away soft tissue and bone. And there's also ringed curettes that look like a ring where there is a hollow center. Suction tips are used to efficiently remove blood and other types of fluid from the surgical site for improved visualization. These suction tips are very smooth as to not damage the soft tissue structures around the area that we're working in as surgeons. And finally, we talk about miscellaneous instrumentation. This can involve K-wires or Steinmann pins. Arthroscopy probes are used inside of joints to help delineate certain parts of the joint or gently retract certain aspects of the inside of a joint. And lastly, we'll talk about rasps and files. A rasp is an instrument that will help smooth down rough bony edges as to not damage the underlying soft tissue or blood vessels. And the difference between a rasp and a file is a rasp cuts in one direction, whereas a file cuts in both directions. These rasps are also important in the operating room to smooth down surfaces of rough bony edges. That concludes our instrumentation categories video, but you will also have a much more in-depth set of videos explaining and delineating these instruments.